So for this section, we're going to be looking at the female reproductive structures in the bovine. And as you can see, this is within a cadaver. So just again to orient you, cranial is this side, caudal is this side, dorsal and ventral. Okay? So what we're looking at here is a view of both ovaries. And within this structure right here that originally was wrapping around the ovary is going to be the mesosalpinx. So we have the ovary, the mesosalpinx, and I can tell that because if we look very close in here, we can actually see the uterine tube running through this mesosalpinx right here. That's the uterine tube. And it's coming all the way down. We can actually see where the isthmus is joining with the uterine horn. We can also see pretty small uterine horns. This is a heifer, so this young girl had never been pregnant before, which is why everything is so small and underdeveloped. Again, we have the uterine horns bilaterally, and then they come into the area of the uterine body. At the bifurcation of the uterine horns, there's the presence of two structures, the dorsal and ventral intercornual ligaments. The dorsal has actually been kind of transected here, but we have a very nice view of the ventral intercornual ligament spanning between the two uterine horns. The uterine body then continues as the cervix. So what we actually have done here is opened up the uterine body, the cervical canal, the vagina, and vestibule. So if we look into the area of the uterine body, if we look very closely, we can actually see these little elevations of tissue within the uterine body. Those are actually the caruncles. So that's the maternal portion that will fuse with the placenta during pregnancy. We will then move from the uterine body into the internal uterine ostium, which is the connection of the cervix and the uterine body. Now when we look into the cervical canal in the bovine, we see these circular folds. And then we see here will be that last circular fold, which will then be moving into the external urethral orifice or ostium and into the vagina. The area around this is called the fornix, or the blind pouch, from where the cervix projects into the cranial portion of the vagina. We then move into the vagina, and I can tell this is the vagina due to these longitudinal folds of the mucosa. As we continue to move caudally, we can see that those longitudinal folds end at this fold of mucosa, and that's going to be the hymen, that transverse mucosal fold that is the hymen. Just caudal to the hymen is this opening that the probe is now passing through. That's the external urethral ostium. So the probe is actually now moving into the area of the urethra and urinary bladder. So the urinary bladder is just ventral to the female reproductive tract. Now there are some structures that are somewhat difficult to identify, especially in this cadaver, because I think they've actually been cut through, but normally there would be two openings right just lateral to this external urethral orifice. Those are going to be the openings for the ducts of the vestibular glands. And then up here there would be two more small holes, and those are going to be those vestigial ductus deferens. We then move down into the area of the clitoris, which is very underdeveloped in this heifer. Some of the other structures that we have to be aware of course, are the vasculature. So again, we've moved cranially to the area of the ovary, and we see this artery that's coming down to the ovary directly from the aorta. That's going to be the ovarian artery. The ovarian artery in the bovine then gives rise to this branch that's coming over here to the uterus. That would be the uterine branch of the ovarian artery. We then see this artery that's actually arising from the umbilical artery, aka the round ligament of the bladder here. This is going to be the uterine artery. So in bovine, the uterine artery comes directly off of the umbilical artery, whereas in the equine, the uterine artery comes off of the external iliac artery. Okay, so what we're looking at here is a very well-developed udder of a cow that was taken years ago and has been really opened up to show some really nice structures. Just to help orient, this side is the cranial aspect and this side is the caudal aspect. To start off with, we can see a very large external pudendal artery coming into this udder. And that allows us to see these two very large branches, this one that would be moving cranially, which would be the cranial mammary artery, aka the caudal superficial epigastric artery. And then we see this branch running caudally, which would be the caudal mammary artery, aka the ventral labial artery. So when we open up this area here, what has actually been done is a chunk of the udder has been removed in order to open that mammary gland up. And that allows us to see all of these small little holes, these small little openings throughout the mammary gland. And those are all going to be the lactiferous ducts. And all of these lactiferous ducts will dump milk into the area of the lactiferous sinus. Now the lactiferous sinus has two parts. We have the glandular part, which is the part that is actually up within the area of the glandular tissue. And then we have the papillary part. So the papillary part of the lactiferous sinus is within the papilla, aka the teat. So milk will then move from the papillary part of the lactiferous sinus and will then move into the papillary duct. You might also hear that referred to as the teat canal or the streak canal. So the papillary duct is what exits the teat at the papillary ostium. Here's a very good view of an external look at a papillary ostium, or the opening of that papillary duct